Welcome to this advanced course on gastric and peptic ulcer disease, designed for postgraduate medical professionals. This comprehensive program will explore the pathophysiology, diagnosis, and management of these common yet complex conditions. We'll examine everything from basic anatomy to cutting-edge treatment approaches, equipping you with the latest evidence-based knowledge to optimize patient care. Understanding the anatomical relationships in gastric and duodenal regions is crucial for accurate diagnosis and effective treatment of ulcerative disease. Gastric anatomy includes the cardia, fundus, body, antrum, and pylorus, with mucosal protection provided by the mucous bicarbonate barrier. Duodenal anatomy consists of 4 parts, with Brunner's glands neutralizing acid, highlighting the importance of these structures in ulcer management. The physiological mechanisms of gastric acid secretion involve a complex regulatory system. Neural control activates parietal cells via acetylcholine, while hormonal regulation by gastrin stimulates ECL cells to release histamine. Receptor activation and acid secretion maintain gastric pH, essential for digestion but potentially damaging without protective mechanisms. When protective mechanisms fail, the pathogenesis of peptic ulcer disease begins. A breach in the mucosal barrier leads to an acid pepsin attack on the epithelium, triggering an inflammatory response and resulting in tissue damage. This imbalance between aggressive factors and protective mechanisms is central to ulcer development. Peptic ulcers are classified into gastric and duodenal types, with specific categories based on location and associated conditions. Gastric ulcers are often linked to malignancy, while duodenal ulcers are associated with hyperacidity. Special categories include stress ulcers and refractory ulcers, each with unique clinical implications. The global burden of peptic ulcer disease is significant, with trends indicating varying prevalence across regions. Understanding these epidemiological patterns is essential for developing targeted prevention and treatment strategies. Helicobacter pylori has revolutionized our understanding of ulcer disease. Discovered in 1982, it plays a crucial role in pathophysiology by creating an alkaline microenvironment and triggering inflammation. Its presence in a high percentage of ulcers underscores its clinical significance and the need for targeted treatment. NSAID-induced ulceration is a significant risk due to COX inhibition, leading to reduced prostaglandin production and increased mucosal vulnerability. Understanding these mechanisms helps in managing and preventing NSAID-related ulcers, especially in high-risk groups. Classical features of peptic ulcers include distinct symptoms for duodenal and gastric ulcers, with warning signs indicating potential complications. Recognizing these clinical presentations is vital for timely diagnosis and management. Atypical presentations of ulcers, especially in elderly patients, NSAID users, and those with comorbidities, can complicate diagnosis. These patients may present with minimal symptoms, highlighting the need for careful clinical evaluation to prevent life-threatening complications. A thorough diagnostic approach involves history-taking, physical examination, risk assessment, and initial testing. This comprehensive evaluation is crucial for identifying ulcer disease, especially in patients with subtle or atypical symptoms. Endoscopy remains the gold standard for diagnosing ulcers, offering direct visualization and biopsy capabilities. Special considerations include assessing malignancy risk and therapeutic options for bleeding, making endoscopy an invaluable tool in ulcer management. Diagnostic imaging complements endoscopy, particularly when endoscopy is contraindicated. Techniques like CT scanning and endoscopic ultrasound provide detailed evaluations, aiding in the management of complex ulcer cases. H. pylori testing is essential for diagnosing and managing ulcer disease. Various diagnostic approaches, including breath tests and serology, offer different sensitivities and specificities, guiding effective treatment strategies. Treatment regimens for Helicobacter pylori involve first-line, second-line, and rescue therapies. These regimens are tailored based on antibiotic susceptibility and patient response, ensuring effective eradication of the bacteria. Pharmacological management of ulcers focuses on acid suppression using antacids, H2 receptor antagonists, and proton pump inhibitors. These treatments are tailored to the severity and type of ulcer, providing effective symptom relief and healing. Preventing NSAID-associated ulcers involves risk assessment, primary prevention strategies, and gastroprotection. Tailoring these strategies to individual risk profiles is crucial for minimizing ulcer risk in patients requiring NSAID therapy. Refractory peptic ulcer disease requires a thorough evaluation to confirm diagnosis and identify contributing factors. Intensifying therapy and considering rare causes are essential for managing these challenging cases. Ulcer complications, such as hemorrhage, require prompt medical management and endoscopic treatment. Understanding the incidence, risk, and classification of these complications is vital for effective intervention and patient safety. Perforation and obstruction are serious complications of peptic ulcers, necessitating immediate medical intervention. Recognizing the clinical signs and employing appropriate diagnostic and treatment strategies are critical for patient outcomes. Surgical management of gastric conditions involves a variety of indications and approaches, each tailored to the specific needs of the patient. Simple closure or mental patching is often used for perforation, while refractory bleeding may require over-sewing or gastrectomy. Obstructions might be managed with vagotomy or drainage, and refractory diseases could involve vagotomy with antrectomy. Suspected malignancy often necessitates partial gastrectomy. These procedures have evolved to be more selective, aiming to reduce long-term complications. Despite advancements in surgical techniques, post-operative complications can still occur. Dumping syndrome, alkaline reflux gastritis, malnutrition, and recurrent ulceration are some of the potential issues patients may face. These complications highlight the importance of careful monitoring and nutritional support following surgery to ensure optimal recovery and long-term health. Pediatric peptic ulcer disease presents unique challenges, with a lower prevalence of H. pylori compared to adults. Secondary causes include medication use and stress-related mucosal damage. Understanding these differences is crucial for effective treatment and management in children, ensuring they receive the appropriate care tailored to their specific needs. Pregnancy and elderly populations require special considerations in managing gastric conditions. Pregnant patients often experience increased gastric acid, necessitating lifestyle modifications and careful medication use. The elderly face higher complication rates and polypharmacy risks, requiring a balanced approach to treatment that prioritizes safety and efficacy. Zollinger-Ellison syndrome presents a diagnostic challenge due to its complex pathophysiology and varied clinical presentations. High gastrin levels and tumor localization require advanced diagnostic techniques, including endoscopy and imaging, to accurately identify and manage this condition. Early detection and treatment are crucial for improving patient outcomes. Patient education and lifestyle modifications play a critical role in managing gastric conditions. Dietary recommendations, smoking cessation, and medication adherence are key components of a comprehensive treatment plan. Educating patients on these aspects can significantly improve their quality of life and reduce the risk of complications. Surveillance and follow-up protocols are essential for managing ulcer types and preventing recurrence. Regular clinical evaluations and testing are necessary to monitor healing and detect any persistent symptoms. Tailoring follow-up care based on ulcer type and patient risk factors ensures effective long-term management. A case study of a complicated H. pylori ulcer highlights the importance of thorough assessment and management. Initial evaluation and endoscopy revealed significant ulceration, leading to targeted treatment and successful eradication. This case underscores the need for comprehensive care in managing complex ulcer presentations. Another case study focuses on refractory ulcer disease, emphasizing the need for persistent evaluation and management. Despite multiple endoscopies and negative H. pylori tests, continued PPI therapy led to symptom resolution. This case illustrates the importance of considering rare causes and maintaining a thorough approach to treatment. Future directions in gastric research are promising, with a focus on personalized treatment approaches and new acid suppressants. Rising antibiotic resistance and biomarker studies are key areas of interest, aiming to improve patient outcomes and tailor therapies to individual needs. Ongoing research continues to advance our understanding and management of gastric conditions.